Okay, this is the bedside shift report poster assignment by Trustee Cassidy.
Cassandra De Los Santos.
And McCracken.
And Emma Laux.
So our PCOT question is, in hospitalized patient, what is the effect of bedside shift report on patient care and satisfaction compared to a report given at the nurse's station within a 6-week time frame? The population that was studied consists of hospitalized patients receiving continuous care and medical treatment. More specifically, patients who were hospitalized overnight and had the possibility to encounter bedside shift report. The research that was collected was from patients admitted to different medical units, including but not limited to med-surg, critical care, and the emergency room.
Hey guys, I'm Anne, and I'm going to be talking about our interventions. So our group intervention was bedside shift report. We wanted to find out if having nurse shift report at the patient's bedside as compared to outside of the patient's room or at the nurse's station would make a difference in patient satisfaction and outcome. So by giving report at the bedside, patients gain an opportunity to participate in their own care and learn the most up-to-date and pertinent information about their health status, which we as a group believed would help to improve patient outcomes and the overall satisfaction that our patients are getting. And so the interventions of our chosen study mainly included surveys and questionnaires that were given during the duration of patient hospital stays and gathering patient information from that.
Okay. Hi, everybody. My name is Emma Laux, and I will be doing the comparison. We're comparing doing bedside rounding versus like rounding at the nurse's station, like report. So I said, not doing a report at the bedside, the nurse's station, can lead to many complications, such as a decrease in safety, increase in miscommunication between patients and healthcare team, and lower patient satisfaction rates. It can also lead to an increased anxiety for the patients and the family. If report is not performed before the patient, they may not know what to expect. That's happening during that shift. It also does not provide them with the time to communicate concerns to the nurse or ask any questions. Report done elsewhere, such as the nurse's station or hall, could cause distractions leading to errors. At the bedside, the nurses can focus on one patient at a time.
Okay. Hi, my name is Trista Cassidy. The outcomes and findings throughout our research really differed between all the different research articles that we wrote. But overall, the main themes throughout our research, we found there was an overall higher patient satisfaction percentage with bedside shift reporting as opposed to doing report at the nurse's station. Some pros that we found were decreased anxiety among the patients. There was a patient perception of increased quality of care, increased accountability among nursing staff, increased safety, and increased teamwork among nursing staff. This is all found out through those different surveys and stuff that they did throughout the research. And as far as increasing the perception of the quality in care, being able for them to ask questions during report was very important to patients. Some cons of bedside shift report, we found that they increased the amount of time taken to give report. It increased interruptions and possible HIPAA violations if there was a roommate or family member present. And it can increase the stress among nursing staff. Most of the cons I found in my study was the increased amount of time that it took for nurses to give report because of those interruptions. So patients thinking they're coming in to take care of them, go get water, blanket, as opposed to there to share information. And as far as the value this is to our practice, knowing the pros and cons of bedside shift report is extremely valuable to everyone in the nursing field. Bedside shift report is being implemented across the United States. It's becoming way more popular. So as a nurse, it's important to keep our patients informed and included in their care, and it helps facilitate that goal. Safety is also always a top priority for nurses. So laying eyes on the patient, making sure all the information that was given to you during report is accurate is very important for the safety of our patients, and that can allow us to correct mistakes in real time. So even if the bedside shift report does take longer as a whole, it is worth the time to ensure patient safety and satisfaction. And that is our references. And here's the poster.